Hi, I'm Dr. Bill Gradishar, Professor of Medicine and the Betsy Bramson Professor of Breast Oncology, Chief of Medical Oncology and Hematology at Northwestern University in Chicago. The toxicity profile of any treatment regimen that we offer to a patient has to be taken into consideration so that we can balance the side effects against the therapeutic advantage. And with trastuzumab deruxtecan, although there are a variety of side effects you might see, most are very familiar, very easily managed by oncologists, and generally well tolerated by patients. Now, the one exception that has gotten everybody's attention is interstitial lung disease. And in the original Destiny 1 trial, there were, and again, these were patients who had gotten significant prior therapy, there was a frequency of interstitial lung disease, including 5 deaths that occurred. The reassuring thing about Destiny 1 was then when the data was looked at with more maturity, not only were the clinical endpoints as good or better with longer follow-up, but there was no increase in severe interstitial lung disease. So in other words, the number of patients who had significant toxicity had not changed from the original observations. In the Destiny 3 trial, similarly, there is a low frequency of these high-grade interstitial lung disease events. So I think the fundamental message has to be that clinicians need to be aware of this as a potential side effect. And if anything, in Destiny 3, where patients have not gotten as much prior therapy, that may be one of the explanations for why we're not seeing as much of it. The other thing that was observed is more of the interstitial lung disease in the earlier trial was observed in patients who were from Asia, and that may have some pharmacogenomic element to the toxicity that we don't yet understand. As we go forward, the guidelines are relatively general. I think we have to be, as clinicians, aware that this can occur. And if you have any suspicion about interstitial lung disease developing, you have to investigate it, look at images of the lungs to make sure you're not seeing a pattern that's consistent with ILD, keeping in mind that many of these patients have gotten prior radiation therapy that can cause some radiologic changes that can be confusing with ILD. But if you remain suspicious that the symptoms are worsening, you should hold the medication, wait till resolution of the ILD, at least to a very low grade, and then consideration of resuming it. But again, for most patients, this isn't a major issue, but you have to be cautious because every once in a while, there have been high-grade, severe episodes of ILD in some of the patients on the trial.